Okay. Y'all know what this is? The whooping cough. Okay. I'm actually going to show y'all a video on this in a minute. So I'll start talking while I'm trying to get it up here. Okay. So y'all know pertussis is whooping cough. It is a bacteria. Yes. All right. It is caused by a bacteria called Bordetella pertussis, which is easy because it's in the name, right? All right. So this is a bacterial cough. Y'all know there is a immunization against it, right? Yeah. But babies can't get it until they're 2 months. It's the DTaP, right? So this is the one that they'll always ask the caregivers to get vaccinated against. Okay. Incubation period 7 to 10 days up to 21 days. So again, you don't know how your baby got it, right? So if you have a baby, just keep them inside for like a really long time. Okay. I'm serious, especially if it's like, can you give me a paper towel? Because there's like some especially if it's RSV season. And don't let people kiss your babies because they'll give them the herpes.
Yep. And now there is a RSV shot.
Yeah, there's been a vaccine for a while, but it's so expensive, hardly anybody can afford it. You have to qualify for it. So if we want a kid to get it, you have to submit a pre-authorization form to their insurance company. And for RSV, you either have to, or you have to meet 2 criteria. You have to be a preemie, like a micro preemie, like a little bit preemie, and you have to either have congenital lung disease or congenital heart disease. If you don't meet that criteria, there's a secondary criteria. There's like 20 different risk factors, and you have to meet a certain amount of the risk factors because it's RSV shot you have to get once a month, and it's $700 to $1,000 a shot. So that's why the RSV season goes from October until April. That's why the insurance companies do not want to pay for it. Yeah, they don't want to pay for it, so you have to authorize them for it.
That's really sad because RSV is like.
It's really bad. It's really, really bad. It is. I've seen, I mean, there's a lot of kids that it's, well, you know. But yeah, I'm seeing a lot of RSV right now. Yes. It's really bad. All right. For pertussis, if you get an infection one time, it's lifelong immunity. So that's kind of nice. I mean, I don't want my kid to get this, obviously, you know, but at least, you know, if they get it and it's mild, which in older kids, pertussis is mild. The video I'm going to show you. The video I'm going to show you is very intense because in little bitties, this can be very bad because, you know, their airways are already super tiny. So any bit of inflammation or illness can make a baby really sick. Anybody can get pertussis and you may not even know that you have it. The typical presentation that I see in older kids is they'll just come in and mom will be like, yeah, she's had this like crazy cough for like a month. It's like just driving her crazy. Kid's not acutely ill. The kid is going to school. The kid is participating in all their activities. And if you think cough for a month, most providers would think like allergies or maybe she has asthma or something, right? But that's how it presents. And they're out there spreading pertussis to everybody. So it doesn't look, it looks very, very different in older kids than it does in babies. Okay. And babies, it can be really ugly. All right, so how do we diagnose? It is a bacteria. So what's the only way we can diagnose a bacteria? Diagnose?
Blood.
How do you diagnose a bacteria? A culture. Y'all, you do a culture. No, not a blood culture. A culture of whatever you're looking for. So, like, for instance, if you're looking for a UTI, what are you doing? Urine culture. If you're looking for a pneumonia, what are you doing? Bacteria. How to definitively diagnose a bacteria?
The culture.
A culture. So their throat. What the fuck is wrong with y'all? If we're trying to diagnose pneumonia, I need a sputum culture. Sputum culture. If you're trying to diagnose meningitis, what are we gonna do?
Throat culture.
Oh Jesus Lord, where is meningitis? In the blood. No, it is not. Where is meningitis? Yeah, I about had it. In your brain and spine. So we would have to do a lumbar puncture culture, right? A CSF. I'm gonna keep doing this till y'all get this because you ain't getting it. Okay. If your patient, you think your patient has sepsis, what are you gonna do? Culture of what? Blood culture. Okay. If you think a patient, they have an abscess and you think it's infected, what are you gonna do?
The culture of the abscess.
Right, you can do a wound culture, right? All right. If you think a patient has an eye infection that you can't get rid of, what are you gonna do?
Swab the eye.
So that's a eye culture. If you think a patient has a bad gut bacteria, what are you gonna do?
Okay.
Huh? Go ahead.
Yeah,
Stool culture. Now are we getting it? Are we okay? Help us, Lord. Help us, Lord. All right. So no, you can do x-rays because you can do an x-ray and the x-ray will show something in there, but that's not definitive. There's lots of junk that could be in there. The patient could have aspirated. They could have a virus. They could have, right? So here is the baby with the whooping cough. I just want to be like, you know, like make her breathe. Yeah, she's still not breathing. She's stuck. Oh, she can't get a breath. Oh, how scary. There goes her pulse ox.
Mm-hmm.
So is it better to? You know, me always say, blow in their face.
Oh, yeah, you're not supposed to. Don't pick that on anyone. Because they're like, oh, that's so dirty. I'm like, the child is deceasing. Okay, like This is called a paroxysmal cough. When they get that coughing fit and they can't get out of it. Paroxysmal means basically like a coughing fit. Oh, little love. At least she started breathing.
I know.
Oh no. And you can put oxygen on, but it doesn't help. You see why they didn't put oxygen on? Because she's stuck in that. And if she's not breathing, oxygen is really going to help. Okay. So that's when little babies with the whooping cough is. Terrifying.
Shouldn't they give them something to relax?
Nope. They just got to let it run its course.
Be put on the pulse monitor, oxygen.
I mean, to have not relax it, to help while it's actually not relaxing.
For what?
For the coughing, you know,
Oh yeah, no, they can't because you don't want to push all of that down. I need them to get it all
Yeah.
up, right? So we don't give cough suppressants or anything like that. And all of PD, we don't give cough suppressants, right? All right. So who's most at risk if they are not immunized and they're under 4? Because remember, the younger they are, the worse the pertussis looks, right? Infants, especially less than 2 months of age, how come they're at risk?
because
Their immune system is not good, and they can't get their pertussis shot until they're 2 months. Okay. Transmission is contact and droplet. Now it is droplet for the most part, but because kids are and they don't cover their cough, you'll add contact as with it. Okay, if you're going to be within 3 feet of the patient. There are 2 different stages of pertussis. So look towards the left. The first one is called the catarrhal stage. Okay, and in the catarrhal stage, you hardly ever catch it during this point because people just think that it's like a cold symptom. Okay. They're just like, oh yeah, no big deal. So you'll see URI symptoms. What's the URI? Upper respiratory. What's coryza? Inflammation of inside the nose. Okay. They get sneezing, cough, low grade fever. I mean, that just looks like a cold.
Mm-hmm.
So if they went to the doctor would be like, you have a cold, go home. Right. So they're not going to get treated during that point. Then it goes into the paroxysmal stage. What did I say? The paroxysmal cough.
It's constant.
Coughing fits. Paroxysmal means coughing fits. Paroxysmal means coughing fits. Good, everyone. So the cough is worse at hour of sleep. That's what HS is, hour of sleep. So at nighttime, they get the paroxysmal cough. They're going to be coughing so much that they get that, you know, like your face gets real red when you cough a lot. So they get very, very flushed. Their eyes may start to bulge a little bit. Their tongue is going to stick out. They're basically like trying to get something in their airway. Okay. And then they will cough. And because there's a lot of mucus, they'll usually throw up after they cough, which is perfectly normal in children because all that mucus is just going down their throat and into their stomach. So their stomach gets filled with mucus. They start to feel real sick and then they'll vomit. Or they'll start coughing. It kind of activates their gag reflex and then they'll puke. Okay. So if you look right in the middle at all these signs and symptoms, looks very much like a cold. And this is why they don't get treated. Runny nose, nasal congestion, a little bit of vomiting, watery red eyes, fever. They don't get caught at that point. It's until they have the violent coughing fits, and then the doctor's like, maybe we should re-examine. Okay. If the kid is less than 6 months, you can see they had, like that kid had an episode of apnea where he stopped breathing, right? He was trying to catch his breath, but couldn't, or she, I guess. Older kids, remember I told you they just come in with, oh, cough for 1 to 2 months. We thought we'd just go ahead and bring her in. You know, the cough's been here for a long time. Damn. All right. Complications that can happen from pertussis. Encephalopathy. What is that? All right. So that's bad. Yes. Because the bacteria obviously is going to start spreading if we don't treat it. Pneumonia. What is that? All right. And they're going to get an infection in there. Yes. What is otitis media? That's an inner ear infection. What's a hernia? All right, it can be here. So here, this is a diaphragmatic hernia where part of the intestines protrude through the muscle wall, right? So we have skin, and then we have fat layer, and then we have the muscle layer, and then underneath that is our organs, right? So in children, their muscles are poorly developed, right? And so there can be a weakness in the muscle, and part of the intestines can protrude through. Kids can also get the umbilical hernia, right here, and then inguinal hernia right where the panty line is. Okay. Now, why would this cause a hernia? It's from the cough. They're coughing so hard that it protrudes through. That's right. It can cause seizures because it's going to go into the brain, encephalopathy. They can get rib fractures. Why would you get a rib fracture? And you're coughing so hard. Yes. They can get dehydrated because what happens when a baby's like that? Can they eat? No, because you can see she had an NG tube because obviously if they're not going to feed her PO, she'd aspirate, right? Remember when infants have a respiratory rate greater than this, you put them in PO.
Respiratory greater than.
It's on the cheat sheet. Do you have your respiratory notes with you? Okay. That's okay. It'd be the very first sheet.
Yeah, it's mixed out already because I was looking.
I see that. Okay, so on the cheat sheet, big giant on the front of the cheat sheet says respiratory rate greater than 60. You need to put the baby in PO, right? Okay. Prolapsed rectum. Damn, that escalated. What's a prolapsed rectum? It comes out. And that's because they're coughing so hard that their rectum can fall out of their body. Yeah, that's bad, right? All right, so treatment. Do y'all need to know the drugs of choice? This is often testable. So it's either erythromycin, clarithromycin, or azithromycin. The top one and the bottom one are most common in PD, the erythromycin or the azithromycin. Okay. We will put them on high flow O2. You can see that baby had a little nasal cannula, right? Now we're not going to put a mask on. That makes it worse for the baby, but you can put them on high flow O2. It'll help them in between the coughing fits, right? IV fluids. Why do you want this kid on a bunch of IV fluids?
Because they'll get dehydrated.
You put them in PO, they'll get dehydrated. They don't feel like eating. We wouldn't feed them anyway, right? All right. So number one priority for this kid, sit them. If their respiratory rate goes over 60, you're going to put them in PO, right? Put them on what type of precautions? Droplet precautions. After the kid is better, then you'll make sure that they have their immunization before they go home. Either the DTaP or the TDAP. DTaP if they're less than this age.
11. DTaP
Go in the middle.
2.
DTaP if they're, I said in the middle. You said 3, you said 11. I said go in the middle, and y'all are like, how about 6 months? 1 more.
7.
Okay, 7. They get a DTaP if they're less than 7. They get a TDAP if they're greater than 7. That's right. That's right. All right, we are going to treat the entire household. Household?
Household.
Yeah, if they live in the hood, go ahead and treat it. The whole house. Let me
Let
start over. The whole household, okay? Because it is droplet, so if one person has it, chances are the whole family is either going to get it or already has it. They're just not completely symptomatic. Of course, you're going to have them on a full socks. That's a given. Do we understand pertussis?
Yes.
All right.